you think there was a little introduction. And second of your, I'm sorry, I can't see, you can't see this on the screen. Yep, you can't, it's working on it. And the second of the presenters from Belfast today, please don't panic. We come in peace. I'm not going to cause any trouble. We just heard that there was a load of money coming into and we wanted. She just, yeah. So, my name is Joe Kane. I am a psychiatrist and a specialist in the Lewy body clinic in Belfast. And as you've heard today, dementia is a group of disorders. It's not one disorder, it's not one disease. And I like to think of dementia as being the end result of a load of different disorders, and a load of different processes. And it's a similar way to the way I think about a song. And a song can be covered many, many different times by many, many different people. And it might be the same song, it might be different vocalists, different instruments, different style, different era, different processes. And whatever the process, they all lead to this end result, this song, which may seem familiar and similar in many ways, but in other ways may seem completely different. And dementia is the term that we've used to describe really the end result. And so the thing about Lewy body dementia is that it represents the end result of a set of processes. And this is what a Lewy body looks like. And you've been hearing a bit about how there's lots of different proteins involved in these processes. And this protein that's involved in Lewy bodies is called alpha-synuclein. It's a protein that's naturally in our bodies, but it's folded in a nice neat structure. And for whatever reason, in whatever way, that nice neat structure starts misfolding. It starts getting tangled, sticky, and other strands of alpha-synuclein start sticking together. And then they start clumping together. And the end result are these spherical, like golf ball-like inclusions that then make themselves known in different brain cells, in different nerve cells, and then they start causing things to go wrong. And that's when we start seeing symptoms. Just like some of the other processes you've been hearing about, these accumulations, these clumping together, the development of these Lewy bodies occur not over 6 months or a year or 2 years. We think that these processes are going on for 10 or 20 years before somebody eventually comes to our clinic. And the thing about these Lewy bodies is that, first of all, they start causing the brain cells to not work as well as they should, and the nerve cells to not work as well as they should, and then eventually these toxic inclusions then lead to the death of particular nerve cells and particular brain cells. And that leads to the point at which we may call something dementia. Now, back in the day, I used to work in a big record store, big commercial record store, and we used to have lots of people that would come to us and say, I heard a song last night and I want to buy it. And we would complain about it, but really we actually enjoyed all getting together and maybe asking that person a few questions, getting a few clues, finding out what version of the song are they talking about here. And more often than not, we would have a more senior person in the record store that would just ask 1 or 2 questions that would seem to open up and give us the answer. And it was always down to normal. It was always But the point is that series of questions and that kind of looking for clues and looking for processes is kind of what we do in the clinic. When somebody comes to us with some sort of difficulty that they've been referred by the GP, we ask them a lot of questions and we're looking for particular clues. And that is the way that this song, this Lewy body dementia song, yes, has similarities to the likes of Alzheimer's disease and other dementias, but also has differences. So when I start asking questions, it's about looking for the characteristics of that song or that dementia that differentiates it from the other forms of dementia that we commonly see. As we heard earlier on, you might have seen some of the statistics. And, Lewy body dementia represents 15, 20, maybe 30% of dementia. And that's where we have looked at the brains of people with dementia after they have died. And we find the Lewy bodies there under the microscope. More often than not, in fact, probably only 1/3 of the time, maybe less, was that person actually given that diagnosis during life. It's something that we aren't as good at looking for and asking for as we could be. But in my specialist clinic, I focus very much on the real differences here. And the first main difference is the memory and thinking difficulties that we talk about. And memory is a word that's come up. Memory services might be the service that you go to. Memory tests might be the tests that you undergo. But that doesn't make sense to a lot of my patients because a lot of my patients say there's nothing wrong with my memory. When we test them, there's nothing wrong with their memory. Memory and thinking and the functioning of your brain is so much more than memory. And Professor Kane highlighted the many ways in which you use your brain already this morning, before you even stepped in the door. Your brain was responsible for doing so many important, complicated, but things we take for granted. And that is where we kind of poke and prod and find out about what difficulties you might have. So a great example is the visuospatial difficulties that we talk about. And some of my patients, again, don't have difficulty with memory, but what they do describe is they're not good at judging their footsteps. They're not good at judging where to sit down. Their judgment of the relationship between shapes and distances and speed becomes compromised. They know there's difficulties. Their loved one usually knows there's difficulties. We don't pick it up in the clinic because we're too focused on memory. The point is, the cognitive signature, the characteristic difficulties are different in Lewy body dementia. And that's why we might ask more about things like attention span, maybe things like the complicated tasks that we call executive function. So if somebody gives you a birthday cake, what do you do with it? You have to plan it out. You need to look around the room and see how many people are there. You need to develop some sort of strategy for making sure everyone gets an equal part. That's executive functioning. And these are the things that many of my patients find difficult, but in some instances might be dismissed or not recognized because it's not a memory problem per se. That isn't to say that some of my patients don't have memory problems, plenty of them do. But it's one of the ways in which we need to broaden our thinking beyond just memory into all the other important things that our brain does. The next thing that I need to do is start hunting around for the symptoms that really only seem to operate in Lewy body dementia. And that's when I start asking the really weird questions. My patients start looking at me funny. There are lots of symptoms, lots of unusual symptoms, lots of that affect all different parts of the body in Lewy body dementia, but these are the best clues that I have. So a good record store person, employee needs to know exactly what the right questions are to ask. Not just asking any question, asking the right questions. And these are what we have for Lewy body dementia. These are the symptoms that best distinguish it from other dementias like Alzheimer's disease. The first one is visual hallucination. That's your eyes playing tricks on you, seeing things that aren't there, being a presence in your peripheral vision. Lots of my patients would see figures in the corner, shadows. Some of them see small animals, some of them see spiders, some of them see much more detailed things. For some of those patients, that's enormously distressing, as you can imagine, certainly if I was seeing spiders. But for some of them, they can make sense of it, they understand it, they know where it's coming from, and they live with it. And that's another important part of unlocking the picture is that when somebody knows what they're dealing with and why these things are happening, it can be an awful lot easier to make sense of it. The second thing is REM sleep behavior disorder. Some of you might have heard of REM, not the band, the sleep stage. So in REM sleep behavior disorder, we see people act out their dreams, kicking, punching, shouting, screaming. And the person that's experiencing these symptoms is dreaming. So the next morning, they don't realize that they were acting. The person that does experience the difficulties there is a person that's in bed with them. You might have been kicked, that winning goal. They might have had a punch thrown at them because they were facing a monster. but the person who experiences that has no recollection of that. That's really interesting because when our bodies go to sleep and when our brains dream, our brain tells our body, okay, you're dreaming now, do not move. So it shuts down all the signals that go to your muscles and all the parts causing movement. That goes wrong in the Lewy body dementia. That connection, that inhibitory process is somehow lost and people act out their dreams. Interesting thing about this symptom is that it is the one which we often see earliest. Long before anyone has any difficulties with memory or thinking, they might experience REM, sleep behavior disorder, 10, maybe 15 years before they even come towards it. And they've just recognized themselves as being a bad sleeper. But it is a sign of a process that is developing in the brain and the rest of the body. Parkinsonism might be a term with which you're familiar. It basically means the symptoms that we classically associate with Parkinson's disease. So losing that smooth, coordinated movement, and perhaps showing itself as difficulty walking, difficulty initiating movement, or in some cases tremors. The difficulty with this symptom is that depending on what record store you go to and what employee you speak to, they might not be that au fait with Parkinsonism. They might not know the right questions to ask. There's no point going to the classical music section and asking for a rap album. That is the difficulty that we see in services, is that people go to different services and because of gaps and blind spots in people's skills, all the clues aren't spotted and the diagnosis sometimes doesn't happen as often as it should. Finally, fluctuations. So that means with the difference between the best part of your memory and thinking in a particular day and the worst part is dramatic. And that can be very, very frustrating for patients and their caregivers, because we have people who go to their clinic, come to our clinic, they're really up for the testing, they up their game and they knock it out of the park. But the care partner then comes into the room and says, earlier on, he couldn't find his way around our house. Big difference between not only hours and days, but sometimes minutes shows itself in these fluctuations. So the best thing that I can do in any clinic is hone my skills to be able to detect these symptoms as best I can. But I also have other tools at my disposal. And sometimes these can become really useful when diagnosis is challenging. Now, indulge me here, okay? There's nothing wrong with your eyes. I know you might find it difficult to work out what's going on here. Can we imagine that there are two pictures here? Can we see lungs in those two pictures? Yeah. And in between the lungs, it's what we call the mediastinum. So lots of our blood vessels come down through there, lots of our nerves come through there. And you might be able to see the outline of a heart. And this really densely stained bit of this scan is a heart, and it's a healthy heart. It's a heart that is using lots of noradrenaline and working very well. The thing about Lewy body dementia is that it's not just confined to the brain. We see these Lewy bodies in nerves that are spread out throughout the body. And one of the ways in which it can show itself is that it disrupts how the heart uses noradrenaline. And therefore, when we go testing for it, what you see over here is a scan of someone with Lewy body dementia. Their heart isn't processing noradrenaline in the same way, and that's because the Lewy bodies have been in those nerve cells in the heart, frankly, interfering and killing off some cells. So we can use this as an early mechanism of detecting Lewy body dementia where there are difficulties. This is perhaps a better recognizable scan, which is used in a bit more widespread basis in the UK and Ireland. Imagine this is a slice through your head, okay? And what you're looking at is two different people. The person here with the nice kind of inverted commas that you can see lit up tells me that the center part of their brain that helps coordinate their nice smooth movements is processing dopamine very well, very healthily, okay? And that's exactly what I expect to see. In someone with a disorder like Lewy body dementia or Parkinson's disease, that part of the brain simply doesn't work as well, and those commas become full stops. And again, that can become a useful tool in the clinic for when the questions that I normally use aren't quite cutting it when it comes to diagnosis. Again, one of the really interesting things about Lewy body dementia is that it is one of the few dementias that works outside the brain. You see it affecting nerve cells way outside the brain. And when we go into the past of people who have Lewy body dementia, and we ask them in detail about the symptoms that they first experienced, it might be sleep symptoms. One of the most common ones is constipation. Another of the most common ones is loss of sense of smell, because the nerves that supply your nose sit kind of outside the rest of the brain. And when you are in the habit of asking people about sense of smell, you'd be amazed how many people have lost their sense of smell in the 10 or 5 years before diagnosis. This tells us that there may be some spread of Lewy bodies. Lewy bodies may start outside of the brain and may work their way up through different nerves into the brain. And what we see sometimes is that in people who don't have any evidence whatsoever of dementia or Parkinson's disease, when we do a post-mortem on them, we find Lewy bodies in all types of places. And generally, they're more developed down below and a little less developed up top. That also happens within the brain. The parts of the brain that are down towards the bottom, those are the parts that seem to be affected most severely initially, but gradually it spreads to the rest of the brain. So we use this knowledge, we use this fact to try and diagnose things better. But when you think about it, that also presents us with some really interesting opportunities, an opportunity to intervene. And one of the ways that we can use that to our advantage is that if we think somebody has Lewy body dementia, if we think that they have signs of something like Parkinsonism, we're not necessarily focusing too much on the diagnosis. We're looking at the processes. So we're no longer just diagnosing in the clinic, we're looking for the proteins that are causing the disease. And one of the ways that we've done that recently is through this complicated diagram. This is called a seed amplification assay. And what that means is that yes, the Lewy bodies might be in your skin, yes, they might be in your appendix, but they're there in such small quantities that I can't see them under a microscope. So what we do is we amplify them. We turn the volume up. We put them together. We take a sample of someone's skin, for example, or from the cerebrospinal fluid, the fluid that bathes their spinal cord. We put it in with some artificial proteins, and we shake it up. And we shake it up and shake it up and shake it up until those clumps grow. We effectively grow the Lewy bodies, and then we can detect them. Okay. So when you think about it, that's really helpful when it comes to early diagnosis. It helps us understand the earlier parts of the process. When you think a wee bit past that, that might give us the opportunity to intervene. So if we're saying that Lewy bodies start in the gut, can we stop that? Can we stop the conditions that make them spread? Can we change diet? Can we surgically remove part of the nerves that goes the superhighway that spreads from the gut to the brain? Can we find some medication to stop them growing as well as they do? So the unique features about Lewy body dementia are the things that we're spending most of our time focused on to try and find it earlier and to try and intervene earlier. And eventually, you want to get to the process whereby you're not necessarily just talking about the song and the artist anymore. You're talking about the instruments, you're talking about the style, you're talking about the vocalist, and focusing in on what makes that song rather than the end stage, which is the song itself. Thank you very much. How do you think about it?